Welcome back to Aging in Arizona. I'm your host, Presley Reeder. I'm here with my co-host, Mark Young, and our guests today are Misha Dick, Vice President, and Serena Schluter, Director of Operations with Health Signal Partners. We've had a great conversation with Misha and Serena so far, Mark, and learned a lot about this Medicare benefit that's available to folks really around managing their wellness. And I've learned a ton. I think it's a benefit that a lot of people don't know about, so we're excited to be here and be able to educate our listeners and their loved ones about it. So if you're somebody out there who knows someone on Medicare, is on Medicare, this is a benefit that's available to you, and we're going to talk more about it here in our last segment, and so that you can better understand it. I'm going to go back to Misha. You had 3 steps that you go through at Health Signal Partners to bring this value to your customers.
Yes, thanks, Presley. So basically the 3 steps, kind of in recap, we've certainly talked about them a little bit, is first one is to get to know the individual, and I'm very consciously not using the word patient here, getting to know the individual, really kind of head to toe, get to know. So we spend an hour, sometimes an hour plus, with every individual understanding not just clinical condition, but really a broader picture to understand what are the challenges from a medical standpoint, but what are the challenges from a life's perspective to be able to live ultimately a healthy life without incidences and acute care episodes. So it's a very comprehensive review. Sorry, Mark, go ahead.
And I think I'm just going to add a little bit on this. I mean, one of the things we did decipher too is that 1 hour is one-to-one face-to-face time. So,
absolutely.
And then later on you bring in your technology to help manage and monitor, which we'll expand on here.
Absolutely, yes. So it's a face-to-face, oftentimes in your physician office with the physician you currently have. If it is a physician we work with, and we work with a number of physicians across the valley, of course. Step number 2 then is to jointly create a plan that, if followed, will enhance the health of the individual. So we take best practices into account that are associated with chronic conditions, but it really goes beyond that. It makes it very, very practical and makes it very personal. So think of it as a personal checklist. Here's what I'm going to do every day that I know I can sign up for doing that. And we put that into a format that's easy to use. It can be literally a folded pocket square kind of a thing, or we also have a technology where it's on your smartphone, or if you're a computer user, on your computer. And to add to that, we're not requiring vast technological expertise. If somebody knows how to use email, they will have absolutely no challenges at all using this type of technology.
And I like how you bring reality into it. I mean, in between segments, you were talking about, the example of the smoker. Well, doctor says I need to quit smoking. Well, they don't tell you how to do that.
Exactly. So the way we think about it is, let's create care plans as a dialogue, not as a one-way street, but as a dialogue of what's really realistic. What do you want to sign up for? We have goals in terms of our health, whether that is we want to improve our condition, we want to prevent something from happening. What are your personal goals? Given your personal goals, given your conditions, what are the things that you realistically think you want to do to achieve those goals and objectives? And a classic example is depression is a big, big factor in not just the senior community, in the community period. And we tend to very quickly go to, for example, medications. And medications obviously play a huge role in depression management, but so does sitting in the sun. A care plan item that we traditionally don't think about as such is to sit in the sun 5 minutes or 10 minutes a day on your front porch. That can be a care plan item, and by the way, it can be a very, very effective care plan item.
I love
Going for a walk is a care plan item. Going bowling once a week can be a care plan item, believe it or not. You have to think about this a little bit broader. So that's kind of step 2, is this creation of that plan. And then step 3 is things are going to get in your way. Our job is to remove those barriers. So we will be in touch, whether it is real-time basis because you're connected through our technology, or periodically because we touch base with you. We're going to have a dialogue about what's working and what's not working. And if something is not working, our job is to remove that barrier through things like community services, through getting your prescriptions refilled, through making an appointment. All those kinds of things are ultimately, that our core job really is removing barriers to have you be successful with the plan that you have ultimately been a part of choosing.
And if you're a family member or another social support individual in somebody's life that's trying to manage all this, you're feeling overwhelmed. There is no doubt about that in my mind. I've talked to so many who are feeling overwhelmed with trying to do those types of things, whether it's encourage somebody to sit in the sun, to go bowling, to take their medications. They are overwhelmed by having to fill that care management role, and you are stepping into that gap.